percussion. Okay, what do you see in the percussion? In the percussion you are going to find if the patient has hepatomegaly or has a splenomegaly, if he is having ascites, and if he is having ascites, is there any shifting dullness present? So these are all the things you are going to look at the percussion. So what does it indicate? Percussion, you are going to look for hepatomegaly, or if he is having splenomegaly, or if he is having ascites, or if he is having shifting dullness. Okay. Now how are you going to percuss? First you are going to percuss all the abdominal areas, then you are going to turn the patient towards the left or the right lateral side. You are going to wait for 30 seconds and you are going to percuss again and out for any dullness. So what does shifting dullness indicate? Shifting dullness indicates if that the patient is having mild to moderate ascites. Okay. So basically in the percussion you are going to percuss all the abdominal areas. Okay, then what you are going to do, then you are going to look for any shifting dullness if present. Okay, if there is any shifting dullness present, first you are going to percuss all of the quadrants, and as they are coming down, if you find any what you call dullness, you are going to turn the patient to the left or the right lateral side, wait for 30 seconds, so that you will allow all the fluid to shift down through the gravity. Then you are going to percuss back again, and again you are going to percuss till the highest resonant point. Okay, so that is called as shifting dullness seen during mild to moderate ascites. Then you will also check for any transmitting wave. In this, what you are going to see is you are going to give a sharp tap on the left side, and it generates a pressure wave on the right side in case of a ascites. You are going to put your finger in the middle, and when you tap from the left side, you are going to feel it in the right side, and if you are going to tap from the right side, you are going to feel it in the left side. So this is generally seen in ascites again. So what is general ascites? What is ascites? Ascites is nothing but is a free fluid in the peritoneal cavity. Okay. And also during percussion you will look for the borders of the liver, borders of spleen, and also look for the, yeah, that's it. Okay, so this is about the percussion. Moving on to the final, that is the auscultation part. Okay, so finally auscultation. So what do we see in the auscultation? In the auscultation, firstly we are going to look for any bowel sounds. Okay, so bowel sounds, if there are any sounds, check for whether the bowel sounds are intermittent, and generally bowel sounds are intermittent and they are generally low pitched, and you will hear them as a chuckling type of sounds. So sometimes you will hear a bowel sound every 10 to 50 seconds. So auscultate for bowel sound generally up to 3 minutes. Okay, and if for 3 minutes if you didn't hear any bowel sounds, then it indicates a paralytic ileus. Okay, so what are generally bowel sounds? They are intermittent, they are low pitched, they are chuckling sounds. Okay, you will hear them as guduk guduk like that. Okay, and this can be heard during 15 to 30 seconds. Okay, so the next thing in the auscultation, you are going to look for any vascular bruits. Okay, what are vascular bruits? Vascular bruits are nothing but as audible manifestations of turbulent flow of blood. Audible manifestation of turbulent flow of the blood. Okay, so sometimes what are all the things that you can hear? You can hear renal bruit. Renal bruit is due to renal artery stenosis. Okay, then You can also hear it during, if there is a patient is having chronic abdominal pain. Okay, so this is seen in mesenteric arterial insufficiency. Mesenteric arterial insufficiency. Okay, then what is claudication? Claudication is nothing but an occlusive disease of aorta and the iliac arteries. So what are the other brutes that you will hear? You will hear renal brute, as I said, and you will also hear hepatic brute, that's it, etc. Okay, then what else you are going to look for? One more thing we have missed. During auscultation, you are going to look for any abdominal rubs. Any abdominal rubs. Okay. So, why does the rubs occur? It occurs due to the result of the inflamed peritoneal surfaces grating on each other. So, it's generally seen during respiration. Okay. So, it is a result of inflamed peritoneal surfaces grating on each other. So, abdominal rust can be due to result of neoplasm, or it can be due to an infection. Okay. So, this is about the auscultation part of the abdominal examination. So, thank you guys, thank you for watching video till the end. Make sure to subscribe and hit the like button and share it to your other friends. Thank you, and I'll see you again. Bye.